Today's topic is Obsessive Compulsive Disorder, or OCD. The Obsessive Compulsive Disorder is a mental disorder that is marked by a pattern of unreasonable, uncontrollable, reoccurring thoughts and behaviors that a person feels the urge to repeat over and over. A person suffering from this disorder may feel the need to check things repeatedly, perform certain routines repeatedly, or have certain thoughts repeatedly. A person with OCD has frequent, worrisome thoughts called obsessions. These obsessions cause anxiety. To try to control and relieve the anxiety, there is an overwhelming urge to perform certain compulsive acts. An example of OCD is having a fear of being contaminated by germs. This is the obsession. To ease such fears, the sufferer may frequently and excessively wash their hands until they are sore and chapped. This is the compulsive behavior or acts. These activities occur to such a degree that they negatively affect a person's daily life and cause daily distress. Obsessive compulsive disorder occurs equally in both male and female. It usually begins in the teen or young adult years. Causes. The exact cause of the disorder is not known. It is believed that the disorder is linked to genetics, biology, the changes in the body's natural chemistry or brain functions, and environmental factors such as infections. Certain factors that may increase the risk of developing or triggering OCD include a family history, traumatic events such as a history of child abuse or other stress-inducing events. Symptoms. People with obsessive compulsive disorder may have symptoms of obsessions, compulsions, or both. Symptoms usually begin gradually and tend to vary in severity throughout life. Symptoms may worsen when greater stress is experienced. Obsessions are repeated thoughts, urges, or mental images that are intrusive and cause distress or anxiety. Common obsessive symptoms are fear of germs or contamination, aggressive thoughts about harming yourself or others, having things symmetrical or in a perfect order, unwanted forbidden thoughts involving sexual or religious subjects. Compulsions are repetitive behaviors that a person with OCD feels the urge to do in response to obsessive thoughts. Common compulsions include excessive cleaning or hand washing until the skin becomes raw, repeatedly checking on things, such as repeatedly checking the doors to make sure they are locked, or repeatedly checking the oven to make sure it is off. Ordering and arranging things in a particular, precise way, such as arranging canned goods to face the same way. Counting in certain patterns. Diagnosis and treatment. Diagnosis is usually based on a physical examination to rule out other conditions, a thorough psychological evaluation that may require discussing your thoughts, feelings, patterns, and symptoms. The diagnosis must follow the criteria written in the Diagnostic and Statistical Manual of Mental Disorders, or DSM, published by the American Psychological Association. Treatment. Psychotherapy is the major treatment option, but this can also be combined with medications. Psychotherapy can be effective in treating OCD. Certain types of psychotherapy, including cognitive behavior therapy, or CBT, is believed to be effective. Research shows that exposure response prevention, or ERP, a type of CBT that involves a gradual exposure to your fear, object, or obsessions, and have you learn ways to cope with your anxiety, may help in reducing compulsive behaviors. Certain antidepressants can help control your condition. Antidepressants approved by the FDA to treat OCD are sertraline for adults and children 6 years and older, fluoxetine for adults and children 7 years and older, paroxetine for adults only, clomipramine for adults and children 10 years and older, fluvoxamine for adults and children 8 years and older. For those who do not respond well to therapy and medications, research is on the potential effectiveness of deep brain stimulation, or DBS. Because DBS has not been thoroughly tested for treating OCD, it is important to understand the pros and cons as well as a health risk. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.